This is why you're not getting better if you have Osgood-Schlatters. We're going to go over the top 3 rehab mistakes people are doing when they have Osgood-Schlatters. My name is Dr. Marco Lopez, Doctor of Physical Therapy and co-founder of the Basketball Doctors. This is not medical advice, just informational purposes. If you need medical advice, send us a message, send us an email, and schedule your free 10-minute consultation. So let's jump into the topic regarding rehab mistakes when it comes to Osgood-Schlatters. So Osgood-Schlatters, if you want to learn more about it, we have a video here talking about all things Osgood-Schlatters. But pretty much Osgood-Schlatters is a growing condition that affects a lot of middle school, elementary school kids as they're growing or after they grow when they have sometimes what they call that painful bump below their knee. So when it comes to this condition, the number one thing that we tell people not to do is not overly strengthen the quad muscles, because Osgood-Schlatters, you're already having a pull in your patellar tendon on that tibial tuberosity, which is that painful bump. So if you keep on strengthening the quad muscles or overusing those quad muscles, you're gonna keep pulling off that bone. And sometimes, worst case scenarios, and I've seen it in the clinic, it might lead to an avulsion fracture, where you actually rip off that painful bump below your knee off your bone, and then you're gonna have to have surgery to place that back into its position. So that's the number one rehab mistake that we see. People continue to strengthen the quads, doing knees over toes exercises, when you have Osgood-Schlatters, you actually want to do the opposite of it. And that's what it comes down to. Our rehab mistake number 2 is people are still playing sports, and we have to, one, actually rest the quads sometimes and rest that knee joint, because it's a growing condition, inflammatory issue, and this one does require some rest, and you got to listen to your body. So the biggest thing I tell people, if you have pain and you're playing through your sport, because when you're playing through your sport, a lot of the kids, especially basketball players, soccer players, football players, they're more anterior chain dominant, so they're going to be using their quads. So going back to the rehab mistake number 1, and that's going to lead to an increased pull and that tibial tuberosity, and may lead to that avulsion fracture. So whenever you're playing the sport, you're using your quads too much, you're not resting, and sometimes you're playing through pain using ice as a way out, and that's increasing that irritation and going to lead to a longer recovery, because sometimes Osgood-Schlatters rehab may last up to 16 months, but there's ways where we could speed up that recovery by resting and going into rehab mistake number 3 is that people don't rehab. We have to be doing the rehab, and there's a lot of things we can do for Osgood-Schlatters. Check out this video regarding some Osgood-Schlatters rehab exercises and stretches, but there's a lot of things. One, we could be strengthening our posterior chain. Our posterior chain are our glutes, hamstring, and calves. Those don't place stress on that tibial tuberosity. The quad does. That's why we don't want to be strengthening the quad or overusing it. Back to rehab mistake number 1 is we want to decrease the tension on the quads and maybe stretch out the quads, the hip flexors, so we put less stress on that patellar tendon, which is going to place less stress on that tibial tuberosity. We also want to work on movement mechanics. As we mentioned, a lot of kids are anterior chain focused, so they're using a lot of their knees as opposed to using more of their backside, their posterior chain, their glutes, hamstrings. So we want to change up some movement mechanics where we're not placing our knees over our toes too much. We're having that in between where we're using our hips as well as our knees, so we can place less stress on the knee joint itself. And another thing that we have to do when we're doing the rehab is proper load management. So the way we kind of manage their load is based on, one, the activities that they're doing, their practices, their jumping, their cutting, but also based on their pain levels. So Osgood-Schlatters is more of a self-limiting issue in regards to, so based on the pain that the kid is experiencing. Normally we give the scale of a 0 to 10 pain scale. So 0 being no pain at all, 10 being the worst imaginable pain ever. So we use that as a way to manage their load. So if they're playing a sport and they're in that 5, 6, 7 range, when then we're doing too much, sometimes it's okay to play through pain, but it's going to be a very minimal, a 1 or a 2. But most of the time we try to keep it at very minimal, a 0. But once we go into the 3, 4, 5, 6, 7, that's a little bit too much, and that's what leads to that overuse more inflammation, more irritation, and more increased risk for that avulsion fracture, which we don't want. So to recap, the 3 rehab mistakes that we have is 1, we're overusing the quads too much. People are still strengthening their quads, but when you have Osgood-Schlatters, that's exactly what you don't want, because that's going to irritate the tibial tuberosity. 2 is you're continuing to play and not resting, not listening to your body. When you have this condition, rest is actually a good thing. As opposed to jumper's knee, we have to be strengthening. And here's a video here between the differences between Osgood-Schlatters and jumper's knee. And rehab mistake number 3 is you're not doing your rehab. You have to be working on mechanics, learning how to use your hips a little bit more, strengthening your hips, your posterior chain, your hamstrings, your calves. And another thing is managing the load and also loosening up those muscles in the front. So if you're still struggling with Osgood-Schlatters after this video, or you need help, send us an email and schedule a free 10-minute consultation, or check out our online rehab program. It's a great Osgood-Schlatters rehab program that you can do at home. But make sure you're doing your rehab and you're not overdoing it, because it might lead to that avulsion fracture, and that's even longer recovery. My name is Dr. Marco Lopez, part of the Basketball Doctors. Let's ball for life.